There are 7 cancer risks who together perfectly represent the 7 deadly sins, and I'll be going over them all.
Starting with the sin of sloth. Sloth is described as a reluctance to work or make an effort, also known as laziness. No cancer risk fits this description better than not working out or doing anything remotely active. Picture Sarah, slouched on her couch, remote in hand, binge-watching her favorite show for the 3rd straight hour. This scene, all too familiar to many of us, represents a modern epidemic, the sedentary lifestyle. While it may seem harmless, this lack of physical activity is silently increasing our cancer risk. Research has shown a strong link between physical inactivity and various types of cancer. According to studies, individuals who lead sedentary lives have a significantly higher risk of developing breast, colorectal, and endometrial cancers compared to those who are regularly active. The American Cancer Society emphasizes the importance of movement, recommending adults aim for 150 to 300 minutes of moderate intensity activity, or 75 to 150 minutes of vigorous intensity activity each week to lower their cancer risk. But how does inactivity contribute to cancer? When we're sedentary, our bodies experience metabolic changes that can lead to obesity and inflammation, both known risk factors for cancer.
Moreover, regular exercise helps maintain a healthy weight, regulates hormones, and strengthens the immune system, all crucial in cancer prevention. An interview between Drs. Peter Attia and Rhonda Patrick explored this topic a little deeper.
The data is more and more compelling, and I think it's become more and more compelling over the years that really exercising seems to be very important for reducing cancer metastasis and also dramatically decreasing cancer recurrence.
They further explained that cancer cells that break away from tumors and circulate in the bloodstream are key to cancer spreading. These circulating tumor cells are extremely fragile and sensitive to stress. They have receptors on their surface that react to physical forces. When you exercise, your blood pumps harder and faster, creating a force these delicate cancer cells can't withstand. It's like a hurricane that wipes them out. Studies show people with more circulating cancer cells are 3 times more likely to have cancer spread. However, physical activity dramatically decreases these cells. Randomized trials prove exercise significantly reduces circulating cancer cells compared to standard treatments, giving our bodies an extra tool against cancer.
And ultimately, they revealed this finding.
Exercise is being prescribed to patients, and it is beneficial with respect to their cancer metastasis reduction and also mortality reduction, like 50% mortality reduction, versus recurrence as well. So I do think there is substantial evidence to suggest that being physically active is a good measure for cancer prevention.
To reduce this risk, start small. Take the stairs instead of the elevator, walk during your lunch break, or do some stretches while watching TV. Incorporating more free movement into your daily routine doesn't require drastic changes.
A cancer risk that you should less do free movement of is the one that I have representing lust. Lust is defined as an intense or unrestrained sexual craving. A cancer risk that has ruined lives and relationships because of lust is human papillomavirus, or HPV. This common sexually transmitted infection can lead to several types of cancer, including cervical, anal, and throat cancers. According to the Centers for Disease Control and Prevention, HPV is responsible for more than 90% of cervical and anal cancers, and about 70% of oropharyngeal cancers. The statistics are sobering. Each year in the United States, HPV causes about 36,000 cases of cancer in both men and women. However, it's important to note that not all HPV infections lead to cancer, and there are effective preventive measures available. Safe sexual practices play a crucial role in reducing the risk of HPV transmission and related cancers. This includes using barrier methods like condoms and dental dams, limiting the number of sexual partners, and open communication about sexual health history with partners.
Perhaps the most powerful tool in our arsenal against HPV-related cancers is vaccination. Dr. Douglas Lowy, Deputy Director of the National Cancer Institute, states, "The HPV vaccine is a safe and effective cancer prevention tool that could potentially eliminate several HPV-associated cancers, including cervical cancer." Regular screenings are another vital aspect of prevention. For women, cervical cancer screenings, PAPI tests, and HPV tests can detect abnormal cells before they develop into cancer. Men and women should also be aware of any unusual symptoms in the genital, anal, or throat areas and seek medical attention promptly.
Another cancer risk that requires prompt action is the one I selected to represent the sin of wrath. Wrath is characterized by uncontrolled feelings of anger, rage, and even hatred. The cancer risk that most relates to these traits is chronic stress. Picture Emily, a working mother of two, constantly juggling deadlines, family commitments, and personal obligations. Her days are a whirlwind of activity, leaving her feeling perpetually on edge, with tension headaches and disrupted sleep becoming her new normal. Emily's experience is not unique. Chronic stress has become a hallmark of modern life, and its effects on our health are far-reaching. When we're under constant stress, our bodies remain in a state of high alert, flooding our systems with stress hormones like cortisol and adrenaline. While these hormones are beneficial in short bursts, their prolonged presence can wreak havoc on our health, particularly our immune system. Research has shown a troubling link between chronic stress and increased cancer risk. A study published in the Journal of Clinical Investigation found that stress hormones can reactivate dormant cancer cells, potentially leading to cancer recurrence. Additionally, the American Psychological Association reports that chronic stress can alter gene activity in immune cells, making them less effective at fighting off potential threats, including cancer cells. But there's hope. Effective stress management techniques can help mitigate these risks. Mindfulness meditation, for instance, has been shown to reduce stress and improve immune function. Regular exercise, another powerful stress buster, can lower cortisol levels and boost natural killer cells, which can play a crucial role in fighting cancer. Dr. Lorenzo Cohen, professor of general oncology and behavioral science at MD Anderson Cancer Center, emphasizes the importance of stress management in cancer prevention. Chronic stress alters our physiology and can contribute to the development and progression of cancer. Implementing stress reduction techniques is a big component of a comprehensive cancer prevention strategy. Another cancer risk is the one I selected to represent the sin of gluttony. Gluttony is characterized by limitless appetite and overconsumption of anything to the point of waste. A cancer risk that is constantly matched with gluttonous tendencies is obesity. The statistics paint a stark picture. According to the CDC, more than 1 in 3 American adults are classified as obese. This epidemic isn't just a matter of appearance. It's a serious health concern directly linked to cancer risk. Research indicates that excess body weight contributes to about 8% of all cancers in the United States, with even higher percentages for specific types like endometrial and esophageal cancers. But how exactly does obesity increase cancer risk? The answer lies in the body's complex biological responses to excess weight. Excess body fat leads to increased levels of insulin and estrogen, both of which can promote cancer cell growth. Furthermore, obesity is associated with chronic inflammation and insulin resistance, conditions that create an environment where cancer cells can thrive. The good news is that this risk is modifiable. Losing weight can significantly reduce cancer risk, particularly for breast cancer after menopause and endometrial cancer. Dr. Peter Adia, a longevity expert, emphasizes this point, stating, "Obesity is now the second most prevalent environmental driver of cancer."
Consider the story of Maria, a 45-year-old who was shocked to learn about her elevated cancer risk due to her weight. Motivated by this knowledge, she overhauled her diet, focusing on plant-based foods, whole grains, and limiting processed items. Over a year, she lost 50 pounds and saw significant improvements in her health markers, potentially reducing her cancer risk. Another cancer risk that involves tracking health markers is the one I chose to represent the sin of pride. The definition of pride is believing that one is essentially better than others, failing to acknowledge the accomplishments of others, and excessive admiration of the personal self.
Meet John, a successful executive who prides himself on his resilience and self-reliance. When he first noticed a persistent cough and unexplained weight loss, he brushed it off as stress from work. Months passed and the symptoms worsened, but John's pride prevented him from seeking medical help. It's probably nothing, he kept telling himself, unwilling to appear vulnerable or worried. John's story, unfortunately, is not unique. Many individuals ignore early warning signs of potential health issues, often due to pride, fear, or simple denial. This behavior can have serious consequences, especially when it comes to cancer detection and treatment outcomes.
The importance of early cancer detection cannot be overstated. According to research, the survival rates for many types of cancer dramatically improve when caught in their early stages. For instance, patients diagnosed with stage 3 colon cancer have an 80% 5-year survival rate, while those with stage 4 have only a 10 to 20% survival rate. This stark difference underscores the critical role that timely detection and intervention play in cancer treatment. Dr. Peter Adia, a prominent physician focusing on longevity, puts it succinctly. To my knowledge, there is not a single example of a cancer that is more effectively treated when the burden of cancer cells in the body is higher than when it is lower. Consider comedian actor Ben Stiller's story, a contrast to John's. Stiller prioritized regular checkups despite his busy Hollywood schedule. During a routine prostate exam in his late 40s, Stiller's doctor detected early-stage prostate cancer. Thanks to this early discovery, Stiller underwent successful treatment and is now cancer-free. His experience aligns with the National Cancer Institute's stance that the majority of cancers are treatable when caught early. Stiller has since become an advocate for prostate cancer awareness, using his platform to encourage other men to get tested, demonstrating how early detection can be life-saving, even for those in the public eye.
The next cancer risk on my list might be the most addictive, and it will be representing greed. Greed is defined as the excessive desire for material possessions and wealth. Meet Alex, a high-powered executive who practically lives at the office. His days start before sunrise and often end well past midnight. Weekends? Those are just 2 more work days for Alex. He wears his 80-hour work weeks like a badge of honor, believing his dedication will pay off in promotions and bonuses.
But Alex's pursuit of wealth comes at a steep price. His constant state of stress, lack of sleep, and poor diet are taking a toll on his body. Research shows that this lifestyle significantly increases cancer risk. Chronic sleep deprivation, a common side effect of overworking, can lead to hormonal imbalances that may promote cancer cell growth. The American Cancer Society emphasizes that maintaining a healthy weight through proper diet and exercise can help reduce the risk of various cancers. But Alex's work-obsessed lifestyle leaves little time for either. Moreover, chronic stress and lack of sleep can lead to inflammation and immune dysfunction, both associated with an increased risk of cancer. Dr. Peter Adia highlighted that lifestyle factors such as poor diet, lack of exercise, and chronic stress are significant contributors to somatic mutations that can lead to cancer. The impact of this greed-driven culture extends beyond individuals like Alex. It's creating a public health crisis, with millions prioritizing work over well-being. This societal shift towards overworking is linked to rising rates of obesity, cardiovascular disease, and yes, cancer.
The good news? Investing in rest and self-care can yield long-term health benefits, including a reduced risk of developing cancer. As one expert puts it, sleep is a critical factor in overall health, and chronic sleep deprivation can lead to serious health consequences, including an increased risk of cancer. Speaking of health consequences, the next cancer risk on my list is more of a behavior that can lead to increased cancer risk, and that's why it's representing the sin of envy. Envy is defined as the feeling of discontent or resentment towards someone else's possessions, qualities, or luck, leading to a desire to have what they have. It often causes negative emotions and behaviors, motivating individuals to compare themselves unfavorably to others and sometimes resulting in harmful actions to match or surpass them. Imagine Sarah, a young professional who feels constantly pressured to fit in with her coworkers. At every happy hour, she finds herself ordering drink after drink despite not enjoying alcohol much. On nights out, she often caves to peer pressure and smokes cigarettes, rationalizing it as a social habit. Sarah's story is all too common, illustrating how envy and social pressure can push us toward risky behaviors that significantly increase our cancer risk. This pattern isn't limited to everyday individuals. Even celebrities, with their seemingly glamorous lives, can fall victim to the dangerous allure of harmful comparisons. Take Charlie Sheen, for instance. The actor's well-documented struggle with substance abuse, fueled by the high-pressure Hollywood lifestyle, led to severe health complications. Sheen's story serves as a stark reminder of how social pressures and the desire to fit in can escalate into life-threatening habits.
Research shows a clear link between these envious behaviors and increased cancer risk. Smoking, excessive alcohol consumption, and drug use, often adopted to fit in or compete socially, are all well-established cancer risk factors. The National Cancer Institute notes that tobacco use alone accounts for about 30% of all cancer deaths in the United States. Health experts emphasize the importance of prioritizing individual well-being over societal pressures. Dr. Otis Brawley, former Chief Medical Officer of the American Cancer Society, states, "Making informed health choices based on scientific evidence, rather than social trends, is crucial in cancer prevention."